You always ask what the best supplement for erectile dysfunction is. Well, I'm Rena, a urologist and pelvic surgeon. If you're new here, I share evidence-based information about urology every day. Today, I'm going to talk about the latest research on a supplement called L-Arginine. Before we get into that, it's important to remember something. Supplements are meant to support your health. They are not a replacement for taking proper care of your body. That means managing conditions like high blood pressure, keeping diabetes under control, eating a balanced diet, and staying physically active. If these basics aren't handled first, supplements alone won't solve problems with sexual function. In fact, the most common cause of erectile dysfunction in men is vascular erectile dysfunction, which usually happens because conditions like high blood pressure or diabetes reduce blood flow to the penis. So, what exactly is L-Arginine? It's an amino acid, which means it's one of the building blocks your body uses to make protein. Normally, your body gets it through the foods you eat. What makes L-Arginine interesting is that it helps the body produce nitric oxide. If you've watched some of my earlier videos, you may remember that nitric oxide plays a key role in starting an erection. Many treatments and supplements focus on increasing nitric oxide because it relaxes the smooth muscle inside the penis. When those muscles relax, blood can flow in more easily and fill the erectile tissue, which leads to an erection. Inside the body, L-Arginine levels can decrease for several reasons. Stress, high blood pressure, diabetes, and other chronic health conditions can all lower the amount of arginine in the bloodstream. When those levels drop, it can become more difficult to achieve an erection, especially when blood flow is already reduced. In 2019, a group of researchers in South Korea conducted a systematic review and meta-analysis studying the use of L-Arginine in men with mild to moderate erectile dysfunction. From this review, researchers analyzed 10 randomized controlled trials. In these studies, participants were given L-Arginine in doses ranging from 1.5 to 5 grams. Their results were then compared with another group that received either a placebo or no treatment at all. The researchers focused on how these groups performed in terms of erectile function. Overall, the findings showed that L-Arginine significantly improved erectile dysfunction when compared with a placebo. More specifically, men reported better results in areas such as overall satisfaction, satisfaction during intercourse, and orgasmic function. However, it's important to note that this meta-analysis only included men who had mild to moderate erectile dysfunction. Some participants may also have taken citrulline, which is a precursor to L-Arginine. In many cases, citrulline can be easier for the body to use. One reason for this is that L-Arginine is metabolized very quickly in the body, which means it often needs to be taken multiple times throughout the day. Another limitation was the length of the trials. Many of the studies lasted only 2 to 4 weeks. A few continued for 8 weeks, and only a small number extended to 12 weeks. Most of these studies were relatively small, and they also used different doses and formulations, which can make the results harder to compare. Because of these limitations, a newer study was recently published. In this research, scientists wanted to evaluate L-Arginine on its own. It wasn't combined with any other supplement, and citrulline was not included. The study lasted for 3 months and also included men with severe erectile dysfunction, meaning they likely could not achieve erections firm enough for penetrative intercourse. In this study, 100 men were randomly assigned to one of 2 groups. One group received L-Arginine at a dose of 6 grams per day for 3 months, while the other group received a placebo. Participants in the treatment group took the supplement 3 times daily, 2 grams per dose, after meals. To keep the results accurate, participants were not allowed to take any other medications or supplements that might increase blood flow or raise nitric oxide levels. So, if someone was already using treatments or supplements for erectile function, they were not included in the study. In studies like this, researchers usually measure results using a well-known questionnaire called the International Index of Erectile Function. This questionnaire has been widely validated. meaning it has been tested in many different populations and closely reflects the severity of erectile dysfunction. The researchers also performed a penile Doppler ultrasound to measure blood flow directly inside the penis and determine whether supplementation actually improved circulation. After 3 months, the results showed that 74% of the men experienced improvement in their erectile function. Most of the men in the study experienced some level of improvement. This didn't necessarily mean their erectile problems disappeared completely, but their symptoms became much easier to manage. In many cases, medications such as sildenafil or tadalafil could likely help them achieve even stronger erections. In fact, about 20 to 24% of the participants had no signs of erectile dysfunction at all after using L-Arginine for 3 months. When it came to safety, the men taking L-Arginine did show a noticeable increase in cholesterol levels, particularly high-density lipoprotein. Many people assume that supplements are completely harmless, but that's not always the case. Some supplements still need proper monitoring. In this study, a few side effects were also reported, including heartburn and itching, especially itching in the scrotal area. While it didn't appear in this specific research, other studies have found that high doses of L-Arginine can sometimes lead to low blood pressure. Another important point is that this study involved a relatively small group of participants, only 100 men. Because of this, the research wasn't fully powered to detect precise differences. In other words, the study wasn't designed around a predetermined number of participants that would clearly show a specific percentage difference between the two groups. Even though improvements were reported, an important question remains. Were the men actually satisfied with the results? In the end, patient satisfaction is what truly matters. Unfortunately, the researchers did not measure or report satisfaction levels after the study was completed. Finally, as Gio Espinosa mentioned in our previous video about supplements, he often recommends L-citrulline instead of L-Arginine. The reason is that L-Arginine is broken down very quickly in the body, which is why it needs to be taken 3 times a day. On the other hand, L-citrulline tends to stay active in the body a bit longer. As always, I hope you found this video helpful and informative. And remember, take good care of yourself because you truly deserve it.